What if I told you a straight line from your pinky toe to your heel is the place we begin to correct misalignment of all of your bones? If I can teach you optimal alignment, then you will know what a line meant. Let us begin. This illustration shows a straight foot from pinky toe to heel. A common misconception is that the foot should be measured as straight from big toe to heel, as outlined here in red. If this were so, then your knees would not be pointing in the direction you walk. Every step you took would cause twisting torque on your knee joint. In order for the bones of your lower leg to line up for optimal knee joint function, the outside edge of your foot must be straight. Your foot is also a lever. Its function is to provide maximum surface area for pushing the ground behind you when you walk. When your foot is turned out, you reduce the amount of surface area that your foot has to push the ground behind you. The next straight line measurement is from head to toe, viewing the body from the side. In geometry, we learn that the shortest distance between 2 points is a straight line. The shortest and densest distance for gravity to travel between the point at the top of your head and the point where your feet touch the ground is an imaginary line through your ear, shoulder, hip, knee, and ankle. The acronym for this is a nonsense word, ESHKA. When your bones are lined up, you are teaching your bones how much density they need to support you standing up and walking by loading them with weight, causing them to thicken. We're often in a seated position and not loading the bones of our hips, legs, and feet. Over time, our connective tissue, or fascia, starts to thicken also so that we don't straighten out all those kinks when we stand up. When we tilt our head forward out of alignment, it creates an increasing burden for your neck to support. It can be like walking around with a 60-pound 8-year-old on your shoulders. That changes to 12 pounds when your ear is over your shoulder. Looking down at your cell phone is another habit that causes malalignment. Simply lifting your phone so that you can view it while your ear remains over your shoulder can restore alignment. The dotted line here shows rib thrusting. This brings the shoulders and hips out of alignment. When the lowest rib is not in line with the hip bones, called the ASIS, or the anterior superior iliac spine, this shifts your weight forward onto your toes and causes compression of the vertebrae of your low back. Here you see a malalignment caused when the hips shift forward and the knees hyperextend. This shifts weight into the toes and asks the tendons and ligaments of your knees and hips to resist gravity, and they will not regenerate and recover like muscle cells do. ESHKA is linear alignment. Let's talk about the rotational orientation of your bones. This illustration shows that when your shoulders shift forward, creating internal rotation, when viewing the body from the front, I can see that the knuckles of your hands face forward. This can cause thoracic outlet syndrome, frozen shoulder, breathing problems, and poor circulation to the brain. Now remember how I first talked about straight feet? When your feet are turned out, your knees follow. Arrows show the direction of movement caused by these holding patterns that cause joints to move in directions they are not designed to. This creates problems of pain and deterioration, a doctor will tell you are common aspects of aging. But please, let's not confuse common with normal or inevitable. Let's put this cartoon man in motion. Using arrows to illustrate the direction of motion created by these holding patterns, you see the following. When the knees bend left and right, and the arms swing side to side, we can see from the front that this creates a shifting motion that causes our head to toggle back and forth. It reinforces impingement in the shoulder and torques the hip, knee, and ankle joints. From behind, you can see it creates a side-to-side wave effect in the spine. Our spine's not built for this. It's designed to absorb shock like a slinky as your body moves up and down, not side to side. Returning our attention to linear alignment, it's also true that as our bodies have adapted to the shape of a chair, we are less and less likely to straighten out our legs when we walk. This transfers the lion's share of the work to our thighs or quadriceps muscles. It shifts our head forward and our weight onto our toes, loading the delicate bones of the toes with weight they are not meant to bear, causing them to build more bone for the task, contributing to hammertoes, bunions, and plantar fasciitis. Keeping ear over shoulder over hip, allowing our legs to straighten as we leave our heel on the ground as long as possible with every step we take, creates a cascade of positive effects. Landing in the heel causes the entire skeleton to vibrate. This tells your skeleton how much bone density it needs to support ourselves standing and stimulates bone growth. Leaving the heel on the ground as long as possible creates a stretch of the Achilles tendon, calves, and hamstrings. It also allows us to push the ground behind us using the buttocks, hamstrings, calves, and full length of the foot. It may sound radical, but walking is not a series of falling and recovering. We are meant to use the large muscles on the back of the body to propel forward by pushing the ground behind us. Now let's incorporate your arms into a beautiful walk with optimal alignment. Reciprocal arm swing adds momentum to your walk. With arms straight, not bent, and your right foot forward, your left arm swings forward. Then you push the left arm back as you transfer your left foot forward, letting your right arm swing forward. You'll be surprised at how much speed you pick up using your arms this way. The health benefit is that you are massaging the lymph nodes in your armpits and groin. A view from the back shows that the proper alignment of your feet and knees ensure that you have use of your entire foot for pushing the ground behind you, and the tendons on the backs of your knees are aligned to prevent hyperextension and knee twist. The health benefit is that you'll get full toe flexion and stretch in the Achilles tendon, calf, hip flexors, psoas, and hip movement up and down, as the hip joint is designed for this movement rather than side to side. To those who tell me, I already know how to walk, or I need a heavier workout, I challenge you to adopt these new habits of walking with optimal alignment and see what happens. My guess is you'll run out of breath, work up a sweat, and run out of steam at half the distance you usually walk. The appearance of someone walking with optimal alignment is majestic. Their stride is long, their arms swing, their hips move, and their head is held high. Let this be you.